Okay, we shall start with antimicrobial agents and continue, move ahead. First, we'll start with sulfonamides. Now, sulfonamides, which are classified as short-acting, intermediate, long-acting, and those for special purpose. Under short-acting, we have drugs like sulfadiazine, intermediate-acting, sulfamethoxazole, long-acting sulfadoxine, sulfamethopyrazine, and those for special purpose, that is sulfacetamide sodium, sulfasalazine, and silver sulfadiazine. Now, these drugs were the initial drugs to be used clinically. As such, singly, these drugs are hardly used nowadays except those for special purposes, that is drugs like sulfacetamide sodium, which are used in ocular conditions, sulfasalazine used in GI autoimmune conditions, and silver sulfadiazine, which is used topically in burns patients. Then we come to cotrimoxazole, which is a combination of trimethoprim plus sulfamethoxazole. Now, this drug, which is a fixed drug combination of trimethoprim and sulfamethoxazole in the ratio of 1:5. Now, this combination is a sidal combination, that is, the organisms are killed by this combination, whereas sulfonamides are having a bacteriostatic action, that is, they will just suppress the growth of the microorganisms. The microorganisms will not be killed, but the growth will only be suppressed with these drugs. Now, coming to the mechanism of action. Now, this drug mechanism of action is very important. It can be asked as a short note. Now, the conversion of PABA, para-amino benzoic acid, to dihydrofolic acid, which takes place by the enzyme folate synthetase. Now, this enzyme folate synthetase is inhibited by the sulfonamide, whereas the conversion of dihydrofolic acid to tetrahydrofolic acid takes place with the help of enzyme dihydrofolate reductase. Now, this takes place with the help of trimethoprim. Now, trimethoprim inhibits the conversion of DHFA to THFA, that is folic acid, which is not formed. So, ultimately, the organisms will be killed. So, this drug, cotrimoxazole, acts by sequential blockade. Mechanism of this drug is very important. It can be asked as a short note. Sulfonamides, as such, these are not asked. Now, coming to the uses of cotrimoxazole. These drugs are used in orodental infections. Apart from orodental infections, these drugs are used in urinary tract infections, bacterial diarrheas and dysenteries, and in AIDS patients to treat pneumonia by pneumocystis jirovecii. So these are the uses of cotrimoxazole. But the use of this drug has declined as such because of resistance. Unless a sensitivity test is done and if the organisms are sensitive, then in such cases we are using this drug, cotrimoxazole. Then we come to the other group of drugs, which are the fluoroquinolones. Now, fluoroquinolones, they are classified into first generation and second generation drugs. First generation drugs are the older drugs like norfloxacin, then we have ciprofloxacin, we have ofloxacin, and pfloxacin. The second generation drugs, which are the newer drugs, they are classified into levofloxacin, then we have lomifloxacin, sparfloxacin, moxifloxacin, gemifloxacin, prulifloxacin. Now, this topic, fluoroquinolones, as such, is a important topic. You can be asked a full question on this topic about the classification, the mechanism of action, and the uses as well as the adverse effects of these group of drugs. Now, coming to the mechanism of action of the fluoroquinolones, they act by inhibiting the bacterial DNA gyrase. So that is how this enzyme, which is inhibited, and thus the drugs are bactericidal in nature. Now we come to ciprofloxacin, which is the prototype drug. Ciproflox in this group of drugs is the prototype drug. It mainly acts on the gram-negative bacilli. The adverse effects of ciproflox, it causes tendinitis, tendon rupture. So the side effects, again, this drug is not used in pregnancy because of the teratogenic effects. Coming to the uses of this drug, ciproflox, it is used in orodental infections, but of course in orodental infections, instead of ciproflox, we prefer Oflox and moxifloxacin, which are more effective on the organisms which are present in the oral cavity as such. Again, these drugs are useful in other infections like skin, soft tissue infections, wound, gynecological infections, and skeletal infections. So these are the multiple uses of the fluoroquinolones as such. The newer drugs, that is the second generation fluoroquinolones like sparfloxacin. Now, Sparflox or the second generation mainly have activity on the gram positive organisms. So they are effective on the gram positive organisms as compared to ciproflox. However, there is a adverse effect related to this drug, that is this drug causes QT prolongation which may lead to arrhythmia. So again, this side effect has to be kept in mind when using this drug. Now we come to the other group of drugs, which are the nitroimidazoles. Now, in this topic, we have metronidazole, which is the prototype drug. Now, again, this drug, metronidazole, is an important drug. Short note can be asked on this topic as such. This drug is the prototype drug in the nitroimidazoles. The half-life, the plasma half-life of this drug is about 8 hours, so it can be given thrice a day. Now, coming to the adverse effects of this drug, metronidazole, it leaves a metallic taste. Once the drug is taken, it leaves a bad metallic taste in the mouth for a certain time, which is not comfortable to the patient as such. Then it also has drug interactions, like it causes disulfiram like intolerance to alcohol. So the patient has to be asked not to consume alcohol after taking this drug. Then coming to the uses of metronidazole. Metronidazole as such is frequently used in orodental infections, especially in ANUG or acute necrotizing ulcerative gingivitis. The dosage of which is 200 to 400 milligrams thrice a day, that is TDS, for a minimum period of 5 days. So that is the dosage which we generally use when we use this drug in case of orodental infections. But generally, this drug is not used alone. It is combined with other drugs which have activity on the other organisms as such. It is also used in periodontitis. So these are the uses of this drug in orodental infections. The other bacterial infections where this drug can be used is in case of antibiotic associated pseudomembranous enterocolitis due to Clostridium difficile. So this is another infection where this drug is quite helpful. It is the drug of choice over here. Again, this drug metronidazole is the drug which is quite helpful in peptic ulcer due to H. pylori. It is one of the components of the triple drug therapy in case of H. pylori infection causing peptic ulcer. The other uses related to metronidazole, it is used in protozoal infections. Now here in protozoal infections, this is the drug of choice. It is the first drug of choice in case of protozoal infections, that is in case of intestinal amoebiasis, then in case of intestinal giardiasis, and in trichomonas vaginitis. So these are the multiple uses of metronidazole. Then there are the other drugs in this group, which are, for example, tinidazole, we have secnidazole, ornidazole. and cetranidazole. These drugs, the advantage of these drugs is the longer half-life. So therefore, these drugs are preferred rather than metronidazole nowadays. Okay, so indications of these drugs are similar to that of metronidazole. Now coming to the beta-lactam antibiotics. Now beta-lactam antibiotics, they are classified into penicillins and cephalosporins. Now they are so called because they have a beta-lactam ring. So this is the hallmark of these beta-lactam antibiotics. So initial drugs are the penicillins and the cephalosporins. The later additions are the monobactams and the carbapenems. So these are the later additions in this group. Now coming to the penicillins, which are the very important drugs nowadays which are being used. The mechanism of action, which is again important, this topic penicillins can be asked as a full question. So the mechanism of action, again in beta-lactam antibiotics, the mechanism, then the questions, the uses of penicillins, the adverse effects. So this can be asked as a full question in this topic. Now penicillin G. This drug, the other name for penicillin G is benzyl penicillin. Now, this drug is having a narrow spectrum. It especially acts on the gram-positive organisms. So, the spectrum is narrow as such. There could be bacterial resistance because of the release of enzyme penicillinase by the bacteria, which may inactivate this drug as such. Again, the another limitation of this drug is it is acid labile in nature, so it cannot be given orally. It has to be given parenterally. Now, the adverse effects again are important of this drug. Hypersensitivity reactions with this drug, which are a major problem, why this drug is not preferred nowadays. So, better drugs which are available now. This hypersensitivity reactions, which are rare, but then it is you can say life threatening, and therefore this drug penicillin G, nowadays the use of penicillin G has declined because of this problem of hypersensitivity. Coming to the uses, it can be used in dentistry for the treatment of acute necrotizing ulcerative gingivitis. However, this drug, because other drugs are there, this drug is penicillin G, which is not preferred for this condition. General medical uses are there. It is specially used in gram-positive infections, that is streptococcal, pneumococcal, then the meningococcal infections. Of course, in STDs like gonorrhea, syphilis, this drug is quite useful. The other infections where this drug can be used are in case of diphtheria, tetanus, and the rare infections like gas gangrene and anthrax. There are the other prophylactic uses of penicillin G, that is the prevention of rheumatic fever. This drug is very helpful, especially benzathine. Penicillin is the drug of choice in case of rheumatic fever. Again, surgical prophylaxis. This drug can be used for surgical prophylaxis to prevent infections in the surgical wound. When in agranulocytosis patients, this drug penicillin G will prevent the infection. So these are the prophylactic uses of penicillin G again, which can be asked in the full question, that write a note or add a note on the prophylactic uses of penicillin G. Now coming to the semi-synthetic penicillins. After penicillin G, we have the semi-synthetic penicillins, which have come up later. Now, these are classified into acid-resistant penicillins, that is phenoxymethyl penicillin, which is also called penicillin V. Now, this drug can be given orally. That is the advantage of this penicillin V. Then we come to the penicillinase-resistant penicillins like methicillin, cloxacillin, dicloxacillin. Now, these drugs, they are generally given in infections where the organisms are producing this enzyme penicillinase. And then we come to the extended spectrum penicillins. Now, these drugs are classified into aminopenicillins like ampicillin, bacampicillin, amoxicillin. Then there are the carboxypenicillins like carbenicillin, and we also have the uridopenicillins like piperacillin, mesdocillin. Now, amongst all these drugs, the aminopenicillins are the most commonly used drugs in case of orodental infections. Now, aminopenicillins, ampicillin is belonging to the aminopenicillins. Coming to the uses of this drug, it is a broad spectrum drug, that is, it is used in multiple infections, it acts on a large group of organisms, therefore, it is broad spectrum in nature. Now, here either ampicillin or amoxicillin, which is combined with metronidazole to treat acute necrotizing ulcerative gingivitis. So, in dentistry, generally, we are combining metronidazole with ampicillin or amoxicillin to treat this condition. So, these are the uses in dentistry as such. Apart from the dental uses, there are the other medical uses. Lot many medical uses are there of this drug. This drug is effective in urinary tract infections. Then, in case of respiratory tract infections, meningitis, gonorrhea, bacillary dysentery, typhoid fever, also in cholecystitis, subacute bacterial endocarditis, septicemias, S. pylori. So, as you can see, multiple uses are there for this drug, but then we are not preferring this drug nowadays because of the resistance and because better drugs are available. So, only where the organisms are sensitive, in such cases, ampicillin is preferred. Adverse effects, it causes diarrhea, which is a very common side effect related to ampicillin. Now, bacampicillin, which is a prodrug, it is converted to ampicillin and then the drug acts. Then we come to amoxicillin. Now, amoxicillin, which is similar, the indications, of course, are quite similar to ampicillin. However, as compared to ampicillin, it has got a better oral absorption and there are less chances of diarrhea with this drug as compared to ampicillin. Again, the frequency of administration of this drug is less as compared to ampicillin. Now, coming to the uses, this drug amoxicillin, which is used in orodental infections, in the dosage of 250 to 500 milligrams thrice a day for a minimum period of 5 days. So, the frequency with amoxicillin is thrice a day, whereas for AMPI, we have to give it 4 times a day or QID. So, that is again another difference why we are not preferring ampicillin. Now, coming to the other drugs in this class, we have the other drugs which are carboxypenicillins like carbenicillin and the uridopenicillins like piperacillin, mesdocillin. These are the anti-pseudomonal penicillins. So, in case the infection is having pseudomonas group of organisms, then these drugs are preferred as such. Now, coming to the beta-lactamase inhibitors. Now, beta-lactamase are a group of enzymes which are released by the gram-positive as well as the gram-negative organisms, and these enzymes, they open up the beta-lactam ring and thus inactivate the beta-lactam antibiotics. So, in certain infections where the organisms are releasing beta-lactamase, in such cases, beta-lactamase inhibitors like clavulanic acid, sulbactam, tazobactam, these are the drugs which are needed to be combined with the other drugs so that the so that the antibiotic is effective against those infections. Now, clavulanic acid, this drug is called a progressive inhibitor. That is, the inhibition increases with time. Initially, it is the later, initially it is reversible, later it becomes irreversible. So that is, again, it is also called a suicide inhibitor. Coming to the uses of this drug clavulanic acid generally is combined with amoxicillin, the combination which is called as co-amoxiclav. Combination of clavulanic acid combined with amoxicillin, which is called as co-amoxiclav. Now, this combination is frequently used in a variety of conditions. So, uses are multiple. It is used in large number of infections like skin infections, soft tissue, urinary, biliary, and respiratory tract infections. Also, intra-abdominal, gynecological, and also in orodental infections, gonorrhea. So, the uses of this combination are multiple, and of course, this drug is the drug which is quite frequently used nowadays. Then, in the same group, that is the beta-lactamase inhibitors, we have drugs like sulbactam, we have tazobactam. Now, these drugs are used parenterally, whereas clavulanic acid is used orally. Now, these drugs, they, for example, sulbactam, which is combined with ampicillin, whereas tazobactam, which is combined with piperacillin. So, these are generally used in the hospital settings because they have to be given parenterally, and it may be cumbersome to give these drugs when a patient is at home, when a person is at home. So, these are generally used in the hospital settings. Now, coming to the other group of drugs, which are the cephalosporins. Now, cephalosporins again belong to the beta-lactam antibiotics because they the nucleus which consists of a beta-lactam ring. It is called the 7-aminocephalosporanic acid. The nucleus which is called the 7-aminocephalosporanic acid. Now, these drugs, they are classified into four generations. The first generation again classified into parenteral and oral. Parenteral drugs like cefazolin, whereas oral drugs we have cefalexin, we have cefadroxil. Then there are the second generation drugs. Parenteral we have cefuroxime, oral we have cefaclor, we have cefuroxime acetyl, and cefprozil. Then there are the third generation cephalosporins, like again third generation, which is classified into parenteral and oral. In the parenteral ones, we have cefotaxime, we have ceftizobactam, ceftriaxone, ceftazidime, cefoperazone. So these are the drugs which are given parenterally, whereas the oral third generation drugs we have cefixime, we have cefpodoxime, ploxetil, we have cefdinir, we have ceftibutyn. So these are the third generation cephalosporins. In the fourth generation cephalosporins, we have only the parental drugs which are cefepime and cefpyrone. So these are the four generations of the cephalosporins. Now these drugs as such are having a bactericidal action, that is the organisms are killed with these drugs. They also have the mechanism of action of these drugs, cephalosporins, is similar to that of penicillin. That is, they act by inhibiting the bacterial cell wall synthesis. Of course, there could be resistance to these drugs by the organisms who, when they release beta-lactamases, which are in this case called the cephalosporinases. So, cephalosporinases, if they are released by the bacteria, then there could be resistance to these drugs. Now, the different generations, the first generation, the spectrum differs with each generation. The first generation ones, especially, are more effective on the gram positive organisms. So, drugs like cefazolin, cefalexin, cefadoxil act mainly on the gram positive organisms. Cefazolin, which is used for surgical prophylaxis, whereas cefalexin, which is oral drug, it is used as an alternative to amoxicillin. Cefadoxil commonly is used in dental infections as such. Coming to the second generation cephalosporins, the second generation are more effective on the gram negative organisms and also on the anaerobic organisms. So that is the spectrum of the second generation cephalosporins. Now, cefuroxime, which is the parenteral drug given parenterally, whereas cefuroxime acetyl, which is an oral drug which is given in dental infections, which is preferred in dental infections. So that is these are the uses of the second generation drugs. Then coming to the third generation cephalosporins. The third generation, there are many drugs, parental as well as the oral ones. They mainly act on the gram negative organisms and also on the pseudomonas group of organisms. Now these third generation cephalosporins are less suitable for dental infections as such. They are not used in or less suitable for dental infections. Therefore, at least, but you should be knowing about these drugs. Cefotaxime, which is the prototype drug in the third generation. The use of this drug is in case of serious life-threatening infections, where the patient, especially in the hospital settings, because again this drug is given parenterally. Okay, so parenterally it is life-saving drug. Then we have ceftriaxone. Then the advantage of ceftriaxone is the longer duration of action with this drug. It can be given once or twice daily. So this is the advantage of ceftriaxone. Again, another advantage of ceftriaxone is that it penetrates the CSF, so it can be used in meningitis patients. So that is the advantage with ceftriaxone. The use of ceftriaxone is in serious life-threatening infections like bacterial meningitis, then in case of typhoid fever, but here it is used in case of multi-resistant typhoid fever. Otherwise, ciproflox is the drug of choice, but if the infection is resistant, then you can go in for ceftriaxone. Then the other uses are in case of abdominal sepsis and septicemias, again, which are serious infections. So this drug is a life-saving drug as such. Coming to the adverse effects, this drug ceftriaxone causes hypoprothrombemia and bleeding. So these are the side effects with ceftriaxone as such. Coming to cefoperazone, now this drug cefoperazone, it has disulfiram-like reaction with alcohol, and therefore the patient should be advised not to consume alcohol after taking this drug, cefoperazone. Then coming to cefixime, which is an oral drug. Now this drug is a long-acting drug. The dosage of this drug is 200 to 400 milligrams BD or twice a day, and it is used in multiple infections like respiratory tract infections, urinary tract infections, and biliary tract infections. So uses are multiple with this drug. With side effect, it causes diarrhea, which is very common with cefixime. Then coming to cefpodoxime proxetil. Now this drug is a prodrug, which is converted to cefpodoxime to become active. Then we come to the fourth generation cephalosporins. Now fourth generation cephalosporins, the spectrum is similar to that of the third generation cephalosporins. However, these drugs are resistant to the enzymes which are released by the bacteria, the beta-lactamases, which are released by the bacteria, and therefore these drugs are used in serious and resistant hospital-acquired infections. So these are the reserve drugs as such, which are used in serious infections as such. Coming to the adverse effects of cephalosporins as such, the there is pain on intramuscular injection with certain drugs. There could be thrombophlebitis on intravenous injection. Diarrhea is common with certain drugs. There could be hypersensitivity again. Certain drugs, sometimes there could be hypersensitivity reactions also with these drugs. Again, some of the drugs are having a nephrotoxic potential, and there could be bleeding again with certain drugs like cefoperazone and ceftriaxone. So these are the side effects which are related to the cephalosporins. Now coming to the uses of these drugs, uses of cephalosporins. Now dental infections, these drugs are used as alternatives to penicillin or amoxicillin. So they can be used as alternatives to penicillin or amoxicillin, and also in penicillin or amoxicillin resistant infections. So where the patient is resistant or where the patient is allergic, in such cases, these drugs can be used. Now here in dental infections, we are generally preferring the oral first or second generation cephalosporins. because they are more effective on the organisms which are present in the oral cavity. Then the other general medical uses, which are again many, these drugs are used as alternatives to penicillin where the patient may be allergic to penicillin. So in such cases, cephalosporins may be the drugs of choice. In the other infections, respiratory tract infections, urinary tract infections, soft tissue infections, then the infections where the organisms like staphylococci, which are releasing the enzyme penicillinase. So in such cases, uh, these drugs are quite helpful. Then in serious infections like septicemia, surgical prophylaxis, meningitis, STDs like gonorrhea, typhoid, mixed aerobic anaerobic infections, and also in serious hospital acquired infections. So these are the multiple uses of these drugs, where these drugs can be used. Okay, so that is about the cephalosporins.